Hey there, welcome back. My name's Chris, an Aussie GP, and today's topic is somewhat sensitive, and that's because I'm going to be talking to you about antidepressants. If you've ever been interested in what an antidepressant actually is, why we use them, how they work, and what they're used for, then this is the right video for you. So, the term antidepressant tends to get a really bad rap. A lot of people I talk to, so my patients specifically, are really concerned that they're really going to alter their mindset. So let's take a big step back. When we talk about antidepressants, there's actually several categories of antidepressants. There's ones called SSRIs, or selective serotonin reuptake inhibitors, SNRIs, selective noradrenaline reuptake inhibitors, which can also be serotonin reuptake inhibitors, TCAs or tricyclic antidepressants, and a couple of other ones. They're the big three, but there are other classes, and some medications belong to their own class. So, what? That in itself is not really a good explanation. But just know when we say antidepressant, there's actually a lot of different antidepressant classes, medications, types, and reasons why we prescribe them. Antidepressants aren't just used for depression. I know, crazy. But antidepressants can be used for a lot of your anxiolytic or anxiety disorders as well. So some antidepressants are actually used for anxiety, so generalized anxiety, obsessive compulsive disorder, and amongst other things. One other reason we use antidepressants is actually pain relief. Crazy. Specifically nerve pain relief. So some of the TCAs I mentioned, such as amitriptyline, at different doses, are actually really good at reducing nerve pain and cancer pain and all sorts of things. So if you're ever chatting with your doctor about pain, anxiety, and they go, I think we should start an antidepressant. It's not that we're not hearing you, and it's not that we're demolishing whatever diagnosis you actually have and going, let's label it depression and move on. It's actually there's evidence that antidepressants will work for you. When I talk to patients about it, I quite often have a bit of a joke and say, look, antidepressants were labelled hundreds of years ago by men sitting at a table going, right, how can we, depression, that's everything, right? Because what we knew about depression then and what we know now is very different. High fives all round, let's go. It's not that simple. So amongst your antidepressant classes are different types of antidepressants. Not everyone is going to respond the same way to one antidepressant as another or as another person would. So sometimes you kind of have to shop around. That's the wrong term. You have to trial different things to figure out what works best for you and your unique circumstances. But, well, how do they actually work? Why are you talking to me about all these things? So, for simplicity's sake, and to keep this video under like 4 hours, I'm going to be talking to you mostly about the most common group of antidepressants, the SSRIs. Again, that's the selective serotonin reuptake inhibitors. Now, there is a lot of complexity to these, and I'm going to keep it really simple. But essentially, the analogy I use with my patients is a little bit bizarre, but stay with me. You're really thirsty when you're depressed. Really thirsty. You have a fridge, and when you open the fridge, you see a glass of water. But as you realize it's there and you want to utilize it, it drains, or it shatters, or whatever. So you had it, but you didn't use it, so you're still thirsty. When we talk about serotonin, serotonin is a chemical in the brain, often called one of the endorphins or happy hormones, although technically not a hormone. And when we have diseases or conditions such as depression, anxiety, etc., we are breaking down the serotonin without utilizing it far too quickly, which means that our moods are. The analogy is serotonin is the water, and what SSRIs do is it allows you to utilize that water before it is taken away. Or, in scientific terms, it allows you to utilize the serotonin before it's reuptaken, or basically broken down and reused. So what it does is it doesn't actually give you any more happy hormones, it lets you use the ones you have. So we're not pumping you full of chemicals, necessarily. We are blocking off receptors that break down serotonin so your body can use it. Increase serotonin, increase happiness most of the time. The benefits of SSRIs, there's a pretty long list really. It can reduce anger in people, it can reduce the feeling of depression and loneliness, but it does have some negative side effects too. So serotonin receptors are not only in the brain, but also in the gut. So some of the most common side effects are related to that. So people on SSRIs may have diarrhea, bad taste in their mouth, dry mouth, too much saliva in their mouth, it all varies. It can also drop your libido. So there's a lot of side effects to them. Yeah, I'm not going to deny that. But for some people, that risk is greatly outweighed by the benefit of not feeling like crap anymore. So it's a really personal discussion you need to have with your doctor if you are considering going on an SSRI or any type of antidepressant. One of the most common questions I get when I'm prescribing or suggesting that I prescribe an SSRI to a patient is, will I become a zombie? I'm going to let you in on a secret, and I can't believe I'm admitting this to the internet, but I've been on an SSRI for years. I'm probably the most animated zombie anyone's ever met then, if SSRIs cause you to become a zombie. It doesn't change your inherent personality. What it did for me is it stopped the absolute fluctuation in my emotions. So I would get so low and so sad and depressed over things, and then I would get so high on like agitation and anxiety. So I'd be sitting in a test, for example, I remember very vividly in my first year of med school, wanting to break down in tears, feeling the palpitations in my chest, sweating, wanting to throw up. And then once I started on SSRIs, and of course my story is very personal and is not going to reflect your own, but I sat another exam not too long after, and I waited. And I didn't get hit by the tsunami of, oh my God. And that's when I knew it was going to work for me. Do I still get sad? Absolutely. Do I still get anxious? Absolutely. But that's where other things like therapy comes in. And therapy is a fantastic thing. The most common type of therapy is CBT, or cognitive behavioral therapy. And it takes thought patterns you have that A goes to B and B is really bad, so then C is going to happen and C is detrimental, so screw it if we get to D, because then it's just going to go back to A, and just that real train, it makes you just stop. A doesn't necessarily have to go to B, and if it does, it's not going to go to C, it can go to here or here, and we have control over our thoughts. I feel like I've been very scattered over this video because it is very hard to give general advice and to give sort of my general analogy, because I do tailor it to every patient. And if you have signs and symptoms of depression, an SSRI may be a good thing for you, and it may not. If you have anxiety, if you have other mental health issues, it may be good for you and it may not. When we start a medication, we do intend to stop it sometime. So the average length when you first start an SSRI for things like depression is 6 months. That being said, we review, and for some people, you are on it for 2 years, especially if you've had depression, have been in remission for it, and then have a, I guess, reoccurrence of it. That's usually when we'll get you on for a longer term. For some people, you're on it forever. And yeah, there are side effects, like I mentioned before. But for some of us, those side effects are okay compared to the absolute devastating, life-altering state you can be in when you are depressed. Again, have a chat with your own doctor. But to summarize, because I always need to summarize, and I feel like I've been scattered, antidepressants are not just for depression. There are several subtypes of antidepressants, and within those subtypes, there are several types of medication. The most common ones are SSRIs, and they focus on serotonin, but there are other things like noradrenaline and other receptors that we can focus on with your antidepressants. They stop your body from destroying the serotonin, noradrenaline, whatever it is, so you can utilize it. They don't change your personality. They are typically used for a time period, but for some people it is indefinite. The side effects will vary, but are usually linked to where serotonin, in this case, receptors are. And ultimately, your journey is so specific to you that it would be just wrong for me to say all of this information is valid to you. So please do chat with your own doctor about it, and please do also consider therapy. These are they go hand in hand so very well. For some people, it is simply chemical imbalance that causes their signs and symptoms. But for most of us, it's also thought patterns, and it's also recognizing boundaries. So therapy is a really good thing. Anyway, this is a much shorter, much, I guess, more informal video. I didn't write a script for this one or anything. So if you've enjoyed it, let me know. If you have any questions, general questions mind you, let me know. Hit like if you liked it, subscribe if you want more content from me. And until next time guys, stay safe, stay healthy, look after yourself including your mental health, and I'll see you later. Bye.